Sir, you're not audible, sir. Sir, please unmute yourself, sir.
Who are watching this program. Namaskar to all of you. I would like to extend my appreciation to All India Medical Institute, New Delhi, the entire team of National Eye Bank for organizing the 36th National Eye Donation Fortnight celebrations and continuing to spread the message of positivity and hope even amidst such challenging times. I deem it an honor to participate in this important program. Friends, I had the opportunity to participate in 2 medical programs. Just now, I was in Hyderabad, participating in a free vaccination program organized by Swarna Bharat Trust. Simultaneously giving vaccination in Hyderabad, Vijayawada, and Nellore. From there, I have flown just now to Chennai to participate in our program. Both the programs are very important. This eye donation is really very useful, purposeful to new vision to the people who are otherwise affected. That's why, in spite of a tight schedule, I said, no, we will be attending this program from Chennai, Rajbhavan. That's why I'm here. The World Health Organization reports estimate that approximately 5% of the world population is blind due to corneal diseases alone. In India, in our country, approximately 68 lakh people suffer from corneal blindness in at least one eye. Of these, 10 lakh people are visually impaired in both eyes. This is the information. The National Blindness and Visual Impairment Survey of 2019 reported that corneal blindness was the leading cause of blindness among patients aged less than 50 years in India, accounting for about 37.5% of the cases. These are grim statistics. In addition, corneal blindness was the second leading cause of blindness among patients above the age of 50 years. The plight of our fellow countrymen and children who are living with corneal blindness is quite unimaginable. At present, corneal transplant is the only cure for corneal blindness. You are all aware, corneas are obtained from willing donors after their death and transplanted in the eyes of the person suffering from corneal blindness. Actually, it's giving a new life, new birth, because regaining the sight is something very important in the life of a human being. There is a huge gap between demand of donors' tissue and supply. This is an area of concern. It is unfortunate that so many people are suffering from corneal blindness because of lack of donor corneal tissues for transplant. Therefore, the need of the hour is to increase awareness among people about the importance of eye donation. Massive multimedia campaigns in local languages has to be launched in every state involving celebrities and icons from different fields. People should be made aware that the noble act of donating their eyes would enable people with corneal blindness to see the beautiful world by restoring their vision. If If all of us make pledge to donate our eyes, we can treat the entire backlog of cases waiting for corneal transplant. This is an achievable goal. We should strive untiringly to accomplish it. Since 80-90% blindness is avoidable, we need to increase eye care facilities to treat cataract, glaucoma, and other ophthalmological problems. Blindness from glaucoma can be prevented, diagnosed and treated early. At the same time, there is an urgent need to devise a multi-pronged strategy for strengthening preventive and curative eye care across the country. No doubt, the union government and various state governments, as well as private sector, are working shoulder to shoulder to reduce blindness through comprehensive eye care services. It is important to ensure that these services are available in rural areas, particularly in the remote parts of the country. Even today, 60% of the people live in the rural areas. We need to focus our attention and also take care to see that the infrastructure facilities for eye care are created in the rural areas. Doctors from urban areas, in cities, they should make a point to visit the rural areas once in a way, every month, to conduct camps and to attend to the patients. And also the hospitals must also have number of sub-centers. I've seen L.V. Prasad unit establishing satellite centers in different parts, including my town, including my village. It's proving to be very useful to the rural people. The Panchayat Raj institutions, urban and local bodies, and non-governmental organizations must be involved in augmenting the effort of the government to provide comprehensive eye care service to people in the rural areas. Large segments of the rural population are deprived of quality eye care. Many people living in rural areas cannot afford the high-cost treatments available at private hospitals and also visit to cities. Therefore, we must equip our public sector eye care hospitals with the latest technologies to provide quality treatment. The fact that the National Program for Control Blindness and Visual Impairment aims at prevention and treatment of visual impairment through provisions of comprehensive universal eye care services and quality service delivery is indeed commendable. I'm told that the National Eye Bank at the Rajendra Prasad Center, All India Medical Institute, was established in 1965 with the aim to promote awareness on eye donation, collect donor eyes, perform transplant surgeries, and promote research. A great work. A structured eye banking system is important to bridge the gap between demand for donor tissues and supply by promoting awareness, facilitating generation of donor tissues, and ensuring their equitable distribution. I'm told that over the last 56 years, National Eye Bank has collected more than 31,000 corneas and performed over 20,000 corneal transplant surgeries. A commendable job. The National Eye Bank has consistently performed more than 1,000 surgeries per year for over 4 years preceding the COVID pandemic. The team at the National Eye Bank has been doing a praiseworthy job by empowering thousands of people affected with corneal blindness with the gift of vision over the last 5 decades. My best wishes to the team at the National Eye Bank for its noble endeavor in restoring vision to thousands of people. My dear sisters and brothers, it is no secret that eye ailment is a problem among young children. There used to be an impression that perhaps the urban school children are more prone to eye ailments. But now even in the rural schools, we found some children suffering from myopia. Excessive exposure of children to video games mobiles, computers, television has been adversely impacting their eye health. We have to educate the children, create awareness among them. Hence, there is a pressing need to regulate children's usage of digital devices to prevent the adverse impacts of excessive use of technology. This is what is being done now, unfortunately. Their children, morning, evening, TV or cell phone or the net. This should be avoided. Otherwise, our future generation, the younger generation, they'll get gadget addiction, which is very difficult to be stopped at a later stage. So this addiction among children is an issue of concern, which needs to be addressed with urgency, and this has to be realized by one and all. The entire country, the education institutions, the parents, the teachers, and the governments at all levels should focus their attention on this, and parents must take care to see that their children do not get addiction to this. Today, the whole world is grappling with successive waves of the COVID-19 pandemic. Globally, all countries are striving to contain the local spread and community transmission of the infection. And the healthcare infrastructure everywhere has been overwhelmed while battling this novel infection. India has done a tremendous job in containing the pandemic despite its huge population and limited resources. As I was telling you, I had an occasion to visit the Bharat Biotech. Today, the management of Bharat Biotech was there with me, the free vaccination camp. Our scientists there, they have done a great job. And we are not only taking care of our people, we are now trying to export also. A lot of routine non-emergency medical activities have borne the brunt of this pandemic. And the e-banking system too has been one of its victims. So I am told that the e-banking guidelines of various countries, including India, advise temporary suspension of donor cornea retrieval and elective corneal transplantation surgeries when active lockdown measures were implemented. This, I believe, has led to almost negligible cornea retrieval during the national and state imposed lockdowns. Of course, lockdowns were necessary. They proved to be useful also. 52% fall in cornea transplant surgeries and 63% fall in donor collection all over India because of this. As our knowledge about this novel virus increases, some experts are of the view that it's highly unlikely for the virus to be transmitted via donor corneas. We have to create awareness about this also. In our country, e-banking activities have been resumed in non-COVID hospitals via the hospital cornea retrieval program. However, I'm told the restrictions placed on cornea retrieval due to the pandemic wave have led to a death of tissue required for corneal transplantation. This has led to further widening the gap between demand and supply of the donor tissues and increase the backlog. In order to tide over the current crisis in tissue availability, innovative measures such as long-term preservation of tissues and the use of alternative surgical procedure, which do not require donor tissues, have to be considered. As our understanding of COVID-19 improves, we may need to modify the guidelines regarding e-banking and tissue retrieval so as to adapt to the continually changing challenges and requirements. It is expected that the resumption of elective surgeries will lead to further surge in the demand for corneal tissues. Thus, in trying times such as these, we need to further intensify our efforts to bridge this gap between availability of corneal tissue and its actual requirement. So my dear sisters and brothers, ours is a country that believes in Vasudhaiva Kutumbakam. Let us remember that share and care is at the core of Indian philosophy. Ours is a culture where kings and sages like Shibi and Dadichi have donated their bodies. These examples are built around the core values, ideals, and samskaras of our society. We have to redefine these values and narratives in a modern context to inspire people and promote organ donation. By donating an organ, one not only helps a person to lead a more fulfilling life, but sets an example for others to work towards the larger good of the society. Due to myths and false beliefs, many people are not coming forward to donate the eyes of their deceased family members. It is therefore imperative to dispel such beliefs and create awareness on the importance of eye donation. Let us donate the gift of vision to our fellow human beings who are in the need of it. What better way to live even after you die? You live after your death. This is a great donation that way. You live after death also by donating your eyes. I would like to request each one and every person pledge not only to donate his or her eyes, but also spread awareness about this noble cause to give the gift of sight. I would like to, before I conclude, I would like to compliment Professor Nityal, Chief of the Rajendra Prasad Center for Ophthalmic Sciences and R&D Medical Institute. I had an occasion to visit him, have his consultation, and also are very much impressed by the young team being assisted, and I would like to compliment all of them. My compliments to the people who have come forward to donate their eyes. I would like to end my speech with the message, donate your eyes, make your eyes live after death. Jai Hind, Namaskar.
Thank you, sir, for your inspirational words. It was an honor to have you with us. We would like to present a plaque as a token of our gratitude to the Honorable Vice President of India. Thank you so much, sir.